Good morning. I would like to call to order the Joint Subcommittee on Human Services. Secretary, can you please call the roll?
Senators Canizaro, Dondero Loop, Stone, Titus,
Here.
Wen,
Here.
Assembly Members Brown May, Dickman, Hafen, Hibbets, Howdigi, Monroe Moreno, Yeager, and Chair Mosca.
Thank you so much. Great to see everybody this morning. I would like to remind everyone to please silence their cell phones and electronic devices. We will have public comment available at the end of the meeting after the budget presentations. Today we will hear 5 budgets, and so I will invite the Department of Health and Human Services, Division of Social Services, Robert Thompson, Administrator, up to the table with fellow presenters. You may go direct to members. When we go to questions, we'll go to questions after each budget item. And please begin when you are ready. And don't forget to state your name for the record before speaking and restate when speaking again. Thank you.
Good morning. For the record, Robert Thompson with the Division of Welfare and Supportive Services. I have with me today Kelly Cantrell, Deputy Administrator, Lisa Swearingen, Deputy Administrator, and in the audience we have with us Deputy Administrator Marnie Whalen, our Chief Financial Officer Crystal Bousquet, and our Agency Manager over Child Care, Brooke Yarbrough, in case there are questions that need to be asked that we're not able to answer. The Division of Welfare and Supportive Services, our mission statement has not changed. We have given a quick snapshot of our organizational chart as a breakdown of our agency. Our agency has over 2,450 people. Thus, the organizational chart is huge. This is just a quick snapshot. When we start talking about our summary of agency operations, our agency is broken down into 6 categories. We have eligibility and policy, which oversees our benefit programs where people apply for benefits, come in, and we determine eligibility. We do outreach within the community. We do employment and training. We have program oversight, which is quality control, quality assurance. We have 2 programs that we provide enforcement for, which are child support and child care licensing. And we have our administrative services, human resources, IT, and fiscal services. Our budget account, our budget request is primarily federally funded. Of the request, we have approximately 23% that is general fund. And on the next slide, we give a snapshot of all 9 of our budget counts, only presenting 5 of these today. So our first budget account that we are presenting is Welfare Administration, Budget Account 3228. That is our administrative account, administration cost, and the overhead for the administration. In this budget account, we have 2 requests for additional funding. M503 is for a National Accuracy Clearinghouse, which is a new database that we will be able to track benefits that when customers are applying for food stamp benefits, also SNAP. If somebody is on benefits in another state, currently we have to call the other states. This is an automated system that has been mandated by the federal government. We will be submitting a budget amendment on M503. M503 is 50% funded by the federal government and 50% funded by state general fund. The original request was incorrect. There will be a budget amendment increasing the state fiscal year 26 to $550,000 of state general fund, and state fiscal year 27 increasing the state general fund request to $154,535 for a difference of $312,903. The second request on this slide is for a on-demand employment verification system. We are required by the federal government and the Center of Medicaid and Medicare Services to have a system that verifies income on demand when our customers apply for Medicaid. Historically, the federal government has paid for this system. They have stopped paying for this system, and we are required to have a system on hand, and the federal government will pay 75% of this request. On the next slide, we are required to fingerprint our employees when we hire them. There has been an update from the IRS requiring that we fingerprint our employees every 5 years. There is a request here to add additional funding, which is also tied to a BDR that we are submitting to be able to fingerprint the employees, our contractors, and our subcontractors every 5 years because we have access to federal identifying information such as Social Security numbers in our system. And the second request on this page adds one management analyst to our IT department, primarily due to reporting and budget budget reconciliation and creation, our vendor services. There are a lot of reports that have been mandated by the federal government that have become extremely time-consuming in that unit. The next request is to add 7 additional positions in our HR unit. Our HR unit, our agency has grown throughout the years, and we have not resized our HR department, so there is a request here to add 7 additional positions in HR. And we do have one request to add a management analyst in our fraud unit, as we are also seeing a significant increase in fraud and seeing a significant increase in people using technology such as AI to attempt to commit fraud. And we are trying to get ahead of that. And when we do find that people have received benefits incorrectly, we are required and would always create overpayments to recoup those funds, and these positions are involved in that. On the next slide, we have had several conversations about our summer EBT program. The next slide funds the summer EBT program. The cost of this for the state fiscal year is approximately $48 million, with the state general fund covering approximately $2.8 million of that. The primary cost in there of the federal cost is the benefit. In this program, we do bring the benefits in directly, but the administrative cost to run the program, the computer systems, the staff, and even those little cards are covered 50% by the state. Our second request on this page requests one management analyst position for our TANF Kin Care program that we will be talking about. This request will have a technical adjustment in it. When you look at the request, you will see that we have requested approximately $600,000 for the biennium for one position. That was a mistake, and it was not caught, and we will be requesting to resize that request down to approximately $94,000 for the first state fiscal year of 26 and $120,000 for state fiscal year 27 with a technical adjustment at closing. The difference will be approximately $402,000 reduction in that request. On the next slide, there is a request in E900 for us to move 6 of our current positions that oversee policy in our Medicaid to transfer those to the Division of Healthcare, Finance, and Policy, proposed to be the Nevada Health Authority for them to oversee policy for the division. And we will now take any questions.
Thank you so much for that brief and helpful overview. Members, if you have questions, please let us know. We will start first with Senator Nguyen.
Hi, thank you. Sorry about that. I had to get my booster seat up here. Like too short up here. Thank you for kind of some of that update, including the new ongoing system costs associated with this new website that it sounds like it'll be up and running in 26. Is that correct?
Robert Thompson, for the record, the National Clearinghouse?
Yes.
Yes, 26.
You kind of had talked about an overview of that project, including any costs that may incurred. I know that you had indicated that there was going to be a budget amendment forthcoming, and it seemed to be a pretty significant change in what the original adjustment would require. Can you kind of explain why there was such an increase?
Robert Thompson, for the record, when the budget was originally built, there was a belief that we would be able to use that system for all of our programs, and it would have been cost allocated across to Medicaid. Medicaid pays a higher portion when we are using the technology. However, this is a strictly SNAP-funded item, and in the SNAP world, we can only utilize 50% federal funds and 50% state funds.
Had you previously been able to use and share those costs with Medicaid, and did it change, or was it just a mistake?
Robert Thompson, for the record, this is a new system. It was a mistake. We believed that we were going to be able to use it for more than just the SNAP system, and after GovRec, we realized that we cannot, and it must be funded strictly to the SNAP program.
Okay, that answers my second question. Thank you so much.
I'll go next to Speaker Yeager.
Thank you. Thank you, Madam Chair. Question I had on this was, in some of the backup documents, it indicates that the federal government wanted the system to be live by October 4th of 2027, but it sounds like Nevada was identified to do it earlier, that we're part of a group of states that need to have it implemented by May of 2026. And I just wondered if you could shed any light on why I know we have to do it eventually, but why we have to do it earlier than the October 4th, 2027 deadline.
Robert Thompson, for the record, Deputy Cantrell has been in those conversations, and I'll let her answer.
Good morning, Kelly Cantrell for the record. So the federal government is rolling this out in groups, and so they put each state into a different group. And Nevada was selected to actually go in Group 12, which is the last group. And that date is, project kickoff will be September of this year with the anticipated go-live date of May of 2026. It's just the way they rolled the groups out.
And if I could ask a quick follow-up, Chair. So I think it's good here that we're in the last group. So my question there is, have you been in communication with the federal government or other states, and have they had issues in rolling this out, or does this look like something that's going to be okay given that we're in the last group and others hopefully have made mistakes along the way that we won't make?
Kelly Cantrell for the record. Yes, exactly what you said. We're actually not upset about being in the last group for that reason, but everything we've heard so far has been pretty smooth, and it is a system that will help us not avoid duplicate issuance for people who are receiving benefits in other states.
Thank you. Next, Assemblymember Brown May.
Thank you, Chair. Thank you for the presentation. It's great to see you here. I'm going to follow up on previous questions really about the system. Have there been any issues that we've experienced with regard to our current participation in that income verification system for Medicaid? Do we have any issues that are outstanding?
Kelly Cantrell for the record. We have not. It used to be something that the federal government did paid for 100%, and in July of this year, they stopped doing that, and so we now have to pay 25% of it, but we've used it for many years, and we don't have any issues.
Thank you. Follow-up, Chair?
Yes.
Thank you. I just have one more then. On, I believe, slide 9, the documentation identified recommended funding of $4.3 million in FY27, which was the estimate of the ongoing annual cost of the state of participation. Are there any one-time costs that are reflected in that amount? Is that all ongoing?
Kelly Cantrell for the record. There is no one-time cost in that. What happens is the price of that kind of creeps up a little bit each year, and so if our caseload grows a little bit, we anticipate that to grow. At this time, we are a little bit static, but it's all ongoing cost.
Thank you. Majority Leader Hattigi.
Thank you so much, Madam Chair. And I want to go to the summer EBT program. Just Just one quick question, maybe two, but it looks like there was about 312,000 children enrolled over the last summer, and it looks like the budget recommendation is to cover 350,000 children per summer for the next biennium. So can you kind of walk us through what kind of outreach you guys will be doing to the families who are on FRL, maybe that aren't on summer EBT? Because it's my understanding that if you're on SNAP, you'll automatically get your summer EBT if you're on FRL loaded onto your SNAP cards. But looks like you guys might be doing some outreach to increase the number of children who receive these benefits.
Thank you for the question, Kelly Cantrell. For the record, you are correct. There is automatic enrollment for several groups, and being on one SNAP TANF Medicaid would be one of those. We did massive outreach, but we are looking to go even further. So we have met with every school principal. We have talked to them, gotten the word out to them. We have done media blasts, which we will do again. And we're going to utilize our outreach staff that are out into the community also to speak to individuals. And we have our FSS that speak to our eligibility staff that speak to individuals that are in front of them, that are on the phone with them. And we anticipate about 350,000 kids, and we're really hoping to get to that with as much outreach as we possibly can.
And do you think that 350,000 covers the entire need? Would that include every child in Nevada who needs the benefit? Well, every child on FRL.
Kelly Cantrell, for the record, we do. We do.
Thank you. And I kind of want to move away from the summer EBT program, and I have a couple of questions on the 7 new positions you guys are asking for your human resources unit. And so just first question, has collective bargaining in any way added to the workload of the human resources unit? Does that contribute to the need for the positions?
Robert Thompson for the record. We're going to have Deputy Whalen come to the table. She is our HR deputy, and she can fill in detail on the granular questions.
Marnie Whalen for the record. For we collective bargaining for the majority of our eligibility staff takes effect on July 1 of this year. So we have not yet seen the impact, but we are anticipating an impact. We're in the they're in the middle of contract negotiations right now.
Perfect. So then these 7 positions would help with that anticipated workload.
Yes, that is correct.
Okay, and then just one more follow-up, Madam Chair. And then, so your current staffing levels, I know you guys are in need of positions, but your current staffing levels, has that impacted your ability to recruit?
Marnie Whalen for the record. We have temporarily used some special project staff to assist us with recruiting in the interim, and these staff will memorialize that to continue those efforts.
Thank you. Next, we'll go to Senator Titus.
Thank you, Madam Chair. I'd actually like to go back to the accurate estimate of ongoing annual costs and the federal income verification system. So yes, we're looking at documentation and being able to verify income, but you mentioned duplication of actually services, and so and that didn't really come up anywhere else, but I think it's a good idea. And so how will this national program then, because we have such a mobile society, so not only will this allow us to document their income, but it's going to allow us better and quicker documentation of duplication. Could you expand on that a little bit? Thank you.
Kelly Cantrell for the record. So the National Accuracy Clearinghouse is a system that allows us to see duplicate benefits in other states. That's separate from the on-demand income verification for the Medicaid system. So the National Clearinghouse does not verify income. It only verifies is someone receiving benefits in a sister state, another state, so that we don't overlap the benefits, hopefully saving money and time.
Thank you, because I think that's been a very big issue for us, especially during the COVID era, the mobile moving to other states and then coming back. And so hopefully people that need the services are getting it. But will we be able to see any of the results of that? How many people you were picked up that were potentially getting duplicate services?
I do think that once we implement this and do a little bit of data on it, we will be able to have an idea of what it saved. Certainly would reduce the amount of duplicate benefits. And like you said, we are a state that folks move into and out of fairly frequently, and so it should help with that a lot.
Great, looking forward to that. Thank you. Thank you, Madam Chair.
Thank you. Please don't forget to say your name for the record. We'll go next to Assemblymember Monroe Moreno.
Thank you, Madam Chair. I'd like to go to E225 and E227. For Decision Unit E225, there's the one management analyst position. What factors are contributing to the need for the increased IT-related oversight and management? And are these factors anticipated to continue beyond the 25-27 biennium?
Robert Thompson for the record. The management analyst position that we are requesting in our fraud detection department, we are seeing an increase in fraud attempts. And fraud that is being completed, often tied to new technology, often tied to AI. We are even seeing people that are using AI to create incorrect paycheck stubs or identification. So the management analyst, and there is additional positions in 3233 that are field positions that will be assisting this. The 3228 position oversees is administration in that unit, and then 3233 is field operations. So as we go forward into the presentation, there are additional positions in request that are not necessarily companion, but part of the group. So we do anticipate that need going forward. We do anticipate the fraud attempts to be increasing. We are struggling with keeping up with the technology. The people that are less than honest are coming out with technology faster than we are keeping up with it.
People are being less than honest. Imagine that. And then, so for Decision Unit E227, that analyst for the investigation and recovery, how will you measure the effectiveness of the investigations in the recovery unit? And you may have gone into that in answering the first one, but if you could just elaborate. And how would the approval of the recommended additional management analyst position improve the unit's operations? I mean, it's hard to stay on top of those that are bad actors that spend all day finding ways to commit fraud, so.
Robert Thompson for the record. We have multiple ways that we refer cases to our fraud detection department. We have a computer system that will actually go out and scope and look for red flags, such as multiple cases being approved at the same house. It's not unusual to have a few cases approved at the same house, but if you start seeing 14, 15, 18 cases approved at the same address, it's a red flag. And then we would start digging in. Many of the referrals are done by our caseworkers. Our caseworkers go through training, and they will be interviewing somebody, and things might not 100% make sense. The benefit still has to be approved because the customer has provided everything we need, but it doesn't all exactly line up. So then they referred over to our fraud detection department. The fraud detection department tracks everything that they received, and they track the amount of benefits that when they go out and do an investigation, they actually track if they end up shutting a case down, how much did it save in the future? So we do have data analytics that we can pull on how well they're doing their jobs, how many referrals they're doing, how often they're going out. But those investigators, they go out into the community. They're not just sitting at their desk going through data. They are, for lack of a better word, a small police department, and they'll actually go out and meet with landlords. They'll go out to hospitals and pull medical records. They'll go out and see, is what was presented to us told the truth? Because a caseworker can't do that, but an investigation department can.
Thank you, Madam Chair. And then you said when they initially have the interview and they have all the documentation, it has to be approved. But then once the fraud investigators or many police department finds out that it is fraud, how long does it take to take that person off the system?
Robert Thompson for the record. If If the income has been verified, then we would take that action immediately and close the case as soon as administratively possible. There are federal requirements that require that we do things like give people 13 days notice before we shut their case down. So we go in and we take the action and update it right away. Then we conduct overpayments and can send people to collections. If they come back and apply later, we will reduce benefits to recoup what was given out incorrectly. And we conduct what is called intentional program violation hearings. So we will actually hold a hearing to determine should this person be disqualified. Some people can be disqualified for 1 year. Some people can be disqualified for lifetime. If you are found trafficking food stamps, if you take your food stamp card, you've created false identities and you're out selling those food stamps, we can go through a process to where we remove them from benefits for their lifetime for the entire United States. And the other system that we are talking about, the duplicate assistance system, will be tracking that also. So if somebody were to apply for benefits here and they have been disqualified at a federal level in another state, we will know that in real time. Currently, we have to call other states, figure out where you've lived, start calling the other states, and it's very time consuming, and now we'll have real-time data.
Thank you so much for that. Thank you, Madam Chair.
Thank you. Members, any other questions on 3228? Yes, we'll go to Senator Titus.
Thank you. Thank you for the second question. But is there ever any prosecution of this? And if so, because these are federal, is it a federal or is it our AG?
So Robert Thompson, for the record, there can be federal prosecution and there can be state prosecution, and we do both. We have prosecuted, and we have, I can't say it happens often, but people have been incarcerated over fraud. And there have been times that we've actually worked with the FBI, and Ms. Wayland's team, Deputy Wayland, is over the investigation department, and they were here with a federal SWAT team from the Secret Service ones that went out and targeted retailers who may or may not have been, those red flags had gone up, to determine if they were not doing things honestly, the less than honest people. But yes, the Secret Service and the FBI can get involved.
Thank you. Senator Stone.
Thank you for the presentation. It appears as though when we have all these new debts that we recollect about 50% of it overall. Yeah, I don't know if you can confirm that. And then does the federal government sanction the state if we don't keep on top of this fraud? I mean, already in 2025, we've already got 1,125 cases, and we're barely into the new year.
Robert Thompson, for the record, the federal government does come out and they do audit us and they do pull sightings. I could not off the top of my head tell you if there was a financial penalty if we do not do enough of the fraud recoup, but I'll get those answers and get them back through LCB.
Okay, and can you follow up with me as far as the advent of AI and its impacts on your program? You alluded to it a little bit earlier, but what are you trying to do to stay ahead of the AI fraud that is going to potentially exacerbate the number of claims that you're going to be having?
Robert Thompson, for the record, we'll put a summary together with the answers for you.
Thank you. And last one on this item, Senator Dondero Loop.
Thank you very much, Madam Chair. I just have a quick question when we were talking about the EBT and the fraud and some of these things that we're addressing. You know, I get the adults not doing the right thing, but that transfers down to children a lot of times. So is there any way that we make sure, if you will, that kids continue to get fed if people are using their cards or their food stamps inappropriately? That affects the child that may, or several children who may live in the home.
Kelly Cantrell, for the record. So when someone incurs an intentional program violation, they are not eligible to receive the benefits for themselves, but if there are children in the household or even other adults who have not incurred the same infraction, they do continue to receive their benefits.
So may I follow up? So So if I'm an adult and I lose my privileges for my lifetime because I've done something inappropriately or somebody in the house is, and several of us in the house, by the way, have done that, and the child gets the card, it's sent to the parent? Is that what happens? Because the child's not going to be able to go to the, Smith's over here and get their food.
Robert Thompson, for the record, that is accurate. The card still is mailed to the adult caretaker of the children. While fraud is very important, and while we are addressing fraud every day, I do not want to make it sound like that fraud is a widespread issue within the agency. It's a small percentage, but with a caseload of our size, a small percentage can add up to a large amount of money. But all data has shown that 97% of our recipients applying for assistance are telling the truth. When we are dealing with the food stamp traffickers and the people that are creating fake accounts through so we've had instances where vendors were actually creating fake accounts and skimming these cards. There weren't any children in the home. These were fiscal agents, and they weren't even in Nevada. So I do not want to give the impression that there is this widespread amount of fraud. Most people use the benefits correctly. Most of our customers tell the truth. Many of our overpayments found by the fraud department were mistakes, and mistakes that cause overpayments are treated differently. We do not prosecute for mistakes. We still recoup the money through the fraud investigation department because they received the benefit inaccurately, but that's what the hearing process is for. So it's a very strict hearing process to make sure that we determine, was this a mistake that somebody didn't understand the question, or were they truly committing fraud? And if there's fraud, we'll discuss prosecution. If there's fraud, we will discuss removing people from benefits for their lifetime. But we don't go in and just shut parents down that made a mistake.
Thank you very much for that, because, well, I understand all the things you just said about the system, and sometimes there aren't even children in the home. I just wanted to make sure that, as usual, children are not paying for adult mistakes or adults deciding what to do with certain things, and the kids are at the other end of that. So thank you very much.
Thank you, and thank you for that important context on the numbers. And we will move on to 3230.
Thank you. Robert Thompson for the record. We are now presenting budget account 3230, which is temporary assistance for needy families. Temporary assistance for needy families is funded through a block grant from the federal government. The state of Nevada is required to put a matching effort, maintenance of effort of matching funds. The block grant amounts were determined in 1995, and there has not been a change to these block grants in that time frame. On the next slide, we start talking about our two major requests for temporary assistance to needy families. The first request is to utilize opioid funding from opioid settlement funds to provide assistance to contracted nonprofit or government entities to provide family preservation or support services for families impacted by opioid and other substance use. In this population, we have had multiple conversations with outside partners, and there is a population here that is receiving or could or should be receiving assistance when adults are using substance uses that are impacting the family, and providing assistance up front or providing assistance to non-parent relative caretakers, we may be able to shore up these families with the overall goal of children not being put into foster care. The second request on the same page is to enhance our current temporary assistance for needy families program to provide assistance through this program, through a computer system that we already have, through processes that we already have, utilizing these funding to provide assistance for guardians of children who are not the parents, relatives, usually grandparents, but it could be aunts, uncles, adult siblings who are raising these children, and when the children have been removed from the home due to substance use. That is all we have on 3230.
Thank you so much. And we do have questions. So first we'll go to Speaker Yeager.
Thank you, Chair. I have a couple of questions, if I could. And I know we were here, maybe it was last week, maybe the week before, and I expressed some concerns about how we're intending to use the opioid settlement funds, and I think Senator Titus agreed with me that we need to make sure that these funds are being used for their intended purpose and not being used to backfill other budget accounts. So, my first question there's two programs here, but on the more traditional TANF program, and I guess before I ask that question, just looking at the budgeting over the last biennium and this biennium, it looks like the big difference to me is we're essentially losing about $7 million in federal funding, but then we're going to basically put another $10 million each year in opioid funding. So could you just talk to me a little bit about, on the TANF program, the Family Support Service Program, how are you going to identify the supports that are needed for an individual recipient, and is this particular enhancement going to be limited to the population that is affected by opioids or substance abuse, or will it go more broadly than that?
Robert Thompson for the record. Forgive me if I misunderstand your question, but I think we're targeting E255 in this question, the temporary assistance for needy families.
So I was actually starting with 254 because I think,
Okay.
yeah, I guess we'll get to the kinship foster care. I think maybe that one's a little easier to understand. It looks like an enhancement, but the TANF money under the E254, how is that going to be used specifically for opioid uses, and then is it going to be broader than that, though? The $10 million that we're putting in of opioid settlement funds in particular.
Robert Thompson for the record. First, I want to make clear in E254, it is not TANF funding that we are using. It is opioid funding. We are using budget account 3230 because we already have a mechanism in place and would not have to create a new computer system and hire new staff and use up 15% of the funding like we normally do, so we're able to move this money through our system that we already have. In E254, the Family Preservation and Support Services for Families, we would be contracting with the non-DWSS entities, and they would have to provide specific reporting back showing that they utilized the funds for children and they utilized the funds for families that were impacted by substance use. Those families would have to go through that process. They would have to work with and we're saying counties, but when we're saying counties, it's a generalization. It will probably be the counties, but it could be nonprofits. But the counties have systems in place where people can apply for these benefits now, and it's expanding those programs to specifically target children who have been impacted by opioid use of their parents or currently being impacted, where those support services could shore up the family to make sure the child's not being removed from and being placed in foster care.
Thank you, Madam Chair, if I may. Thank you for the clarification, because that really was my concern, is the $10 million in opioid funding over the biennium for that program. And I understand you're using an existing budget account, but that's the source of the funding. So I hear what you're saying, and I think that satisfies my concern. I guess on the back end, when we get to the next legislative session, if we're looking at this budget account again, how will you determine the effectiveness of using that $10 million opioid settlement money in terms of whether it meets the goals enunciated in the plan for the opioid money?
Robert Thompson for the record. One of the reasons we specifically chose to use budget account 3230, the temporary assistance for needy families, is we have a unit under Deputy Cantrell they are called our eligibility and payments unit. And they are well versed in the TANF grant process. And in the TANF grant process, there are very strict requirements proving how the money was used. they must submit those receipts, for lack of a better word, to be able to continue receiving the funding. So by using the same reporting process that we already have in place, but adding the criteria in the reporting process that it must have been an impact of opioid use, we are confident that we will be able to build those reports.
Great. And Chair, if I could ask just a couple more, thank you. If we approve this recommendation for the additional 10 million coming from the opioid settlement funds, when would you anticipate being able to issue the subawards and have the local agencies begin providing those supports for families?
Kelly Cantrell for the record. Since many of these entities we have worked with in the past, we don't anticipate it taking more than 6 months, hopefully, to get this up and moving.
And Chair, can I ask one last question? And I promise this will be my last. I did want to move on just quickly to the kinship care grants, because we have the same, and this is budget account E255, the same sort of mechanism where we're going to propose to use $10 million in opioid settlement funds. And I just wanted to confirm, it looks to me like you're going to use that to expand the program. So I assume that that means, same sort of question I asked before, the 10 million opioid settlement will be targeted to families, families who are taking care of, I mean, it's a great program, obviously, but the kinship foster care program when they're taking care of someone who needs care because of opioids in the family. So if you could just confirm that that's what you intend to do with the $10 million, I think that would satisfy my concern.
That is Robert Thompson for the record. That is accurate. In the TANF program at this time, we have a kinship care program that requires the non-parent relative to be 62 or older and have guardianship. And that is a current program that we currently fund, and we've been funding that for as long as I can remember. The request that has been coming to us repeatedly is that most grandparents are younger than age 62 now, and children are being removed from their parents due to opioid use, and young grandparents or aunts and uncles or even adult siblings that are only 19 years old are raising these children, but they're not eligible for the program because of the 62-year age. By utilizing these funds, we can expand the program, remove the age limit of the guardian, but target only the children that have been removed due to opioid use, and we would do that all through our normal TANF processes, our interviews, our application system, to make sure that and the children would be referred to us through the legal aid and through drug court, so we would know that they were appropriate to receive this funding.
Senator Nguyen.
I just have some questions regarding some of the proposals to administer, I guess, these expanded benefits with these opioid funds. And I think kind of what stood out to me was that of this $10 million, $1 million is budgeted to fund an amendment for the information technology vendor Deloitte. So it's going to cost an additional $1 million to distribute $9 million. And can you kind of provide a timeline for what those system changes might be to expand this program and why it's so expensive?
So Robert Thompson for the record, and I believe you're talking about specifically the TANF kinship program, E255.
That's correct.
In the 255 program, because it's expanding a current program and we have to track those funds, we will have to build a new aid code in our system to make sure and keep the monies separate from the actual federal funds. So there is a new aid code that will be required, and that is a system upgrade. And then there are the administrative cost of having a human being go in and make sure that the funds are all used appropriately. So the computer system and aid code would be for this fiscal year, but as this moved forward, we would not be requesting those for future bienniums.
The $1 million upgrade to your system to be able to track the $9 million in funds would be a one-time cost?
Robert Thompson, I'm going to pass to Lisa Swearingen. She is over our IT department.
Thank you.
Good morning. For the record, Lisa Swearingen. So normally when we've requested, and you'll see them, I'm sure, throughout the session, when we have to do a new aid code in our system, which is a way that we would track these new programs, one aid code costs approximately $850,000, just the coding itself. But then this is going to require changes to the system so that it's doing the budgeting different, it's tracking these individuals differently, and then be able to produce those reports that we need. And so all of that kind of compounds, and it's 2 programs, not one. So, I mean, I think we figure, we always charge at vendor time, which is about it's gone up to $200 an hour. So that's kind of where that cost is up front, and it's 2 different programs that we would be looking at. And then Deloitte is our current eligibility vendor, so they would be the ones making those changes.
Thank you. I think that answers my questions. I don't know if it gives me any comfort, but thank you. I got into the wrong line of work is what I realized very quickly here. I guess my next question is, if this is approved and we get this new aid code and we're able to distribute these funds, like when do you anticipate beginning the issuance of these care grant benefits to recipients? When will they actually see the remaining $9 million distributed?
Robert Thompson from the record. Normally it takes 6 to 9 months to build the new aid code and roll it all out, and I would estimate 9 months.
Thank you.
Senator Dondero-Loop.
Thank you very much. This is sort of on the same line, a thought that just came as we were discussing this. When somebody applies for these funds, are the cutoff levels of their, Social Security or their money that they receive maybe from a job, whatever it may be, when they're raising grandchildren or nieces, nephews, whoever they may be, are those determined by the federal government or by the state and local entity?
Robert Thompson for the record. In the TANF program, the states have a lot of latitude to be able to move it, but I do know that there are limits to what we can do through the state plan. And with over 100 years of experience at this table in the TANF program, we're looking at each other and we are not sure, and we're going to have to get back to you.
Okay, I just know that I've received a couple emails along the way where, I don't know, somebody's, one child ages out, then they still have children at home, their Social Security goes up, $10, $15, and then they lose these types of projects in money, and it's a lot because the $15 that went up on the Social Security doesn't help do what they need to do raising children.
Robert Thompson for the record. That is accurate in the TANF program because it is a pass-fail. Unlike the food stamp program that has a graduating, in the TANF program, if you are eligible, you're eligible. So if you squeaked in $5 under the income level and then you receive a raise, it does throw you off. And we do see that cliff effect often in social services.
Right. And I'm sure while anybody on Social Security is happy for the raise, the $5 is, a gallon of gas. So thank you very much, and I look forward to seeing the answers.
Senator Nguyen.
Sorry, I just had time to contemplate the delay and how long it would take to get this program up and running. And you said somewhere between 8 months. And, I get that it takes some time. Given that the fact that it will take a while to get that new, program and, up and running, would we prorate the asks in the first year and move it into the second year because we wouldn't even be able to distribute those funds until the second year of the biennium?
Robert Thompson for the record. We could prorate the request, keeping in mind that these funds don't expire, and we could roll them forward. So if there are more families coming on than originally anticipated, we would not have to build wait lists.
Perfect. Thanks.
Thank you. And with that, we will move on to 3233.
Robert Thompson for the record. Budget account 3233 is our welfare field services. It's really the meat and potatoes of what we do in the Division of Welfare and Supportive Services. These are primarily our caseworkers, our offices where people go to apply for assistance, and this budget account is funded from other budget accounts, from the TANF program, from the Center of Medicaid and Medicare Services, from the SNAP federal government, and general fund comes into this. In this program, we track how many customers apply for assistance. We track how long each one of those actions take when somebody applies for assistance. We have approximately 1,225 caseworkers on staff at this time, and we do anticipate a slight increase, a very small increase of the needed staff to continue business to make sure the benefits are rolling out. We are requesting additional 36 positions in 3233, 6 administrative assistants, 27 family service specialists, and 3 family service supervisors. These are primarily to issue the SNAP food stamp, Medicaid eligibility, and TANF eligibility programs. As we talked about earlier, E227, while not a specific companion to the fraud position that we requested in 3228, it is all part of that unit, and it has the same reasons for the request. We are requesting 1 supervisor over the compliance investigators and 6 additional compliance investigator positions to enhance our investigative capabilities, as we talked about earlier in the presentation. The next slide simply shows our TANF projections in caseload. TANF is projected to stay fairly flat over the next biennium. All of the programs in this budget account are anticipated to stay fairly flat. Some slight increases in SNAP, which is where we see the increase in need for staff. We also do like to point out in these programs, simply because we see the caseload not necessarily growing does not mean we're not working with families. We are seeing an increase in applications with an increase in denials. When we see that commonly when inflation comes in and wages go up. During the labor shortage, more people were able to be employed, which we saw a reduction in the TANF caseload at that time. But we also see people making higher wages than ever before. So we are seeing an increase in applications, but that crosswalks to more work for us when there's a decrease in approvals. In our division, we determine Medicaid eligibility under a memo of understanding for the Division of Healthcare Finance and Policy proposed to be the Nevada Health Authority. And this slide is the projections of how many individuals will continue receiving Medicaid over the biennium. The next slide is our SNAP projections. SNAP projections, as I said, the caseloads aren't necessarily growing, but the workload is growing. Prior to COVID, we were seeing approximately, I believe it was something like 85 to 87% of our applications being approved, and now we're only approving 81% of them, which creates a significant amount of work for our caseworkers to sit and meet with families to tell them they're not eligible, and we go through conferences and hearings and soft handoffs to the food banks. So I would never want to give the impression that just because a caseload has a slight decline that the workload is going to decline. We're seeing an increase in workload. The next slide is simply a visual that we provide at each legislative session because it's a really nice snapshot of our customers in the welfare division. Our customers, very few of our customers receive only one program. 55% of Medicaid recipients also receive an additional program. 90% of SNAP recipients receive additional programs, which is logical. If you're coming in and in need and eligible for the SNAP program, you'll also apply for Medicaid. There are a few people that receive SNAP assistance that do not apply for Medicaid, and that can also often be veterans or people that are receiving Medicare. And that concludes the presentation for that budget account.
Thank you. We have questions. We'll go first to Senator Nandaroloup.
Thank you very much, Madam Chair. Can you discuss the definition or the elements that comprise that client transaction used in the staffing model?
Robert Thompson for the record. I'm sorry, could you repeat that?
Can you sort of discuss the changes to the definition or elements that comprise a client transaction used in the staffing model?
Robert Thompson for the record. I'm sorry, I don't understand the question, the changes.
So when the client transaction is used with the staffing model, are there changes to that?
Robert Thompson for the record. In our staffing model, we track all actions that each one of our caseworkers take. We track how long those actions take. We have a database system that's a task-based system. When we were caseworkers, we used to have caseloads, and now we have tasks, and we track how long each one of those tasks take. When there are changes about how long a task can take, depending on how complicated the work can get, and we do track how long it is, I am not sure I'm answering your question.
So I think part of the confusion is when you were talking to fiscal staff, you weren't able to connect the transactions with client base. Okay. Does that make sense to you now?
Yes, Robert Thompson for the record. I'm sorry, I wasn't tracking the question. So historically, when we've come forward to legislative...
I may not have been tracking my question either, so go ahead.
So Robert Thompson for the record. Traditionally, when we come forward in legislative session, we have a staffing model that indicates we need X number of staff to continue our services. And we did that staffing model as we always had, and the request that we were going to come to the table with, if I recall right, was approximately 144 new employees were going to be needed. But I've been doing this caseload, I've been involved in the staffing model since 2003, and when we submitted our agency request for 144, we went back and revisited that when we were going into GovRec, and we realized that we had a record number of staff who have worked here for less than 1 year. And our staff go through a tremendous amount of training. There are thousands of pages of regulations that they have to learn. The first 3 months with our agency, they are seriously in a college-style classroom. They do not do one bit of casework. So when I looked at that staffing model and I realized historically we had always run right at 14% of our staff had less than 1 year, but we were currently running at almost 27% of our staff were running at 1 year, I realized that we were asking for too many staff. And if we had gone forward with asking for 144 staff, and then all of them came up to speed after 1 year that we anticipate they will, because we train people and they get faster. They're very slow in that first year. We would be overstaffed, and we would end up cutting staff in 2027 or coming to you and telling you that we had too many staff. So I readjusted the staffing model offline with conversations through LCB and reworked the data, anticipating how much these staff will be able to work after the current biennium going into July 1st of next year through the next biennium. And we were confident that the new number is the 36 and not the 144.
Okay, I think you may have answered part of my second question. So then I'm just going to ask for confirmation of the staffing levels recommended by the governor for the 25-27 biennium. Will that be sufficient then to manage the anticipated caseload changes for the biennium?
Robert Thompson for the record, yes.
Okay. All right. Thank you very much, Madam Chair. I appreciate your time.
Thank you. Majority Leader Hadigi.
Thank you, Madam Chair, and thank you. I have questions regarding the new positions for the Investigations and Recovery Unit. And so I was going through the information that we were provided in our notes, and it looks like there's a good amount of cases that go uninvestigated every year just because you don't have the manpower to do it. So can you walk us through how 7 new positions are going to reduce the number of priority cases assigned to each investigator? And then on top of that, do you know, will that reduce to zero the number of cases that go uninvestigated each year?
Robert Thompson, for the record, we're going to ask Deputy Wayland to come back to the table. She is our Deputy over Investigations and Recovery.
Good morning, Marnie Wayland for the record. So we currently, I think you probably have some of this information. Last year, we have a process where if a case goes over a certain amount of days, we consider it aged out just based on the information timeliness and that types of things. So we are currently, we receive referrals all the time, and then some of them get aged out. We do base those and assign those based on priority. So we are anticipating, I don't know that I have an exact number of how it would reduce that caseload, but with 6 additional investigators, they're each usually assigned 20 investigations at any one time. So that would be another 120 cases that would be able to get assigned. So I wouldn't see it zeroing it out, but it would definitely increase our ability to do the priority cases.
And just a quick follow-up. So I thought it was 7 new positions, new investigator positions that were recommended.
So we have the 6 investigators and then a supervisory compliance investigator.
Okay, and so it won't get it down to zero. So each investigator handles about 20 cases at a time?
At one time. They're generally assigned 20 cases at one time.
Okay, and so it won't get the uninvestigated cases down to zero. And that brings me to my follow-up question. Are we in jeopardy in any way, or has any corrective action been taken by our federal partners for our inability to investigate all cases?
Marnie Wayland for the record, no, we have not.
Thank you. Thank you, Madam Chair.
Thank you. Members, any other questions on this budget item? Thank you. We will move on to 3267.
Robert Thompson for the record. Budget account 3267 is our child assistance and development program, also known as our child care and development program. This budget account is made up of 3 funding mainstreams. It is much like the block grant of the TANF program. We receive specific funding from the federal government, and then the state of Nevada puts in a mandatory match to be able to receive that funding. In this program, we are requesting 2 program officers and 1 administrative assistant position to assist with our new payment management system, the information system that we are launching. And that is the only enhancement in that budget account.
And thank you. We do have a few questions. We'll go to Majority Leader Canizaro.
Thank you, Madam Chair. I want to talk a little bit about the caseload projections and the funding that is currently being proposed in the budget for the child care subsidy program. So, as I understand it, you all are taking some steps to reduce that caseload to match the funding levels. So can you tell us a little bit about what steps you're taking to reduce that caseload and how families currently receiving child care services are being informed of those benefits and eligibility changes? Because I believe that some of them under this proposal may lose some of those subsidies.
Thank you for the record. Lisa Swearingen. So we have implemented several different processes. We've had to reduce those numbers down to what we're estimating right now is about 7,500 kids per month under the subsidy program. Right now, we are currently at a little over 13,000. We are seeing a reduction every week of about 200, 250 kids rolling off. And this is mainly because we've had to implement a change in how we determine income limits. So new applications that come in are evaluated at 41%. However, we do have, I think it's 40, oh, hold on. 49% when they renew, so that gives them, like, if an individual comes in, they were on the program, they're allowed to increase their pay by like 19% in order to stay on the program. However, if they're over that, they do roll off. We've had to reduce that, unfortunately, with all of the money that came into the program through COVID. We kind of opened the floodgates. We covered all of these individuals. And we've had to take steps to get us back down to what our federal grant is, which is about $114 million. However, we can only sustain $96 million approximately for these subsidy programs.
Can you explain that piece a little bit? Because you just said that the federal grant was about 114 million, but you can only sustain 96, was it?
For the record, Lisa Swearingen, yes, so 75% of the 114 million goes to subsidy. 12.5% we are required to do quality by the federal government. And so then the remainder of that is to cover admin costs.
Okay. Can you talk to us about how you're informing families? Because it sounds like you're taking steps to put in these income requirements, and so that will inevitably result in some families losing this. And I think you mentioned there were about 1,300 per month rolling off, and you're trying to get from about 13,000 down to 7,500.
For the record, Lisa Swearingen, yes.
How
So
are you letting them know?
we have, we send communication out on a regular basis. We have, we've done webinars with the providers and the parents, and we do after hours because obviously people are working, so we try to open that up for them so they can log on, have those, the staff are on the call with them so they can answer those questions. And then we have, I believe we're doing notifications out to the providers, PTs, which are our policy transmittals, and just other communications, social media, all of that, we're pushing that out. The websites are all updated. And so we're doing everything we can to have those, we have weekly calls with Children's Cabinet and Urban League, just so that they can help push that information out to people. And we're doing everything we can to streamline a process, because we are making changes internally as well.
A lot of that information sounds like hopefully people are getting pushed out from other places. Are you all contacting these families who are getting subsidies and like sending a letter or making a call to them so they know specifically like, hey, you may be losing this subsidy?
For the record, Lisa Swearingen, yes, we are the ones holding those webinars. We are the ones reaching out to them and getting those scheduled, and so that we can work through that. We've been actually, one of the projects that we've put in place right now is we're looking to pull eligibility in-house for the child care providers. And so what that looks like is we have been reaching out to all of these providers and working with them to get signed up with the, I think it's the treasurer's office, to get an EFT number so that we can then do payments and stuff for them. So they're in the process of doing that. And then that's going to streamline that process. So yes, we are contacting them because we're in the process of pulling all of these payments in-house anyway so that we can get those payments out faster. So we are in communication with them on a constant basis.
Again, I think I'm hearing communication with providers and then hoping that families get on webinars. But are you sending out actual communications to the individual families who are receiving those subsidies?
For the record, Lisa Swearingen, I can't guarantee that. I would have to phone a friend.
I would appreciate any follow-up on that, because obviously that's concerning if somebody is going to be losing a subsidy and we're hoping that they're going to hear that information from another source, or hoping that they're going to like jump on a webinar.
Okay, so for the record, I did just get a head nod from Brooke Yarbrough. She is my agency manager over the child care program, and she did state that, or nod, that yes, we are notifying all of the parents as well.
Okay. Are there families that are currently receiving child care services anticipating losing those benefits on July 1st of 2025 because of the reduced funding alone?
For the record, Lisa Swearingen, no. This is a constant process that we're working through right now. We would continue to fund that. and we would pull money as best we can. So one of the things that we're doing is when I stated that we're looking to pull eligibility in-house, that's going to reduce that cost that we're currently paying another vendor to do. And so that's going to hopefully increase that number of kids that we can cover. It's going to streamline the process, get their eligibility determinations faster, get those timesheets processed faster, get those payments out the door within 14 days, which we're already doing. And so I think that we're putting this in place and doing it in-house, which is what we're used to doing anyway, is it's just going to increase that, it's going to reduce that admin cost that we're paying somebody else to do because we're already doing it. And so I'm hopeful that that number comes up and we're going to be able to cover more kids than what we are right now. But as it stands, and it's really depends on the level of care and what we're paying right now. I think the average is about $203 a week that we're paying out. And it's just totally depends on how many of those kids and the level of care they're in. Obviously, the younger ones are costing more money than the older children. And so it just kind of depends on who's currently being covered.
Do you anticipate changing other eligibility requirements to further manage the caseload?
For the record, Lisa Swearingen. So we've implemented a attendance-based model right now, and that's mainly to get a better handle on what's going on with the program. We are looking at doing by pay by enrollment, which is what's required, I believe, by the federal government. And so that's one of the other things that, I'm getting ready to go to an RFP to get a new eligibility and payment system in, and that is one of the things that new system will do. But other than that, no, I don't anticipate any major changes other than that coming to the program.
Okay. And you believe that will help to bring down the number of families that are served to that 7,500 that you anticipate being the total max number of households to be served?
So for the record, Lisa Swearingen, we are already seeing that number reduced by about 200 cases or kids a week. So that number is already dropping significantly. Just doing the income changes, because a lot of people are rolling off. They're over that 49% when they're renewing, and so they're already rolling off. And some of them are just not reapplying as well.
Do you anticipate requesting any adjustments to the revenue and expenditure authority included in this budget when updated caseload projections are provided?
For the record, Lisa Swearingen, at this moment, no.
And I'll just, Madam Chair, kind of make a comment. Obviously, this is tough because it is very expensive to get childcare for kids. It's also an economic issue for a lot of families and for our community as a whole. I would note that this is also a place where we have significant federal funding that is providing these subsidies to folks who are making very little money. It's like $31,000 a year for the initial qualification. And so definitely we'll be keeping an eye on this and probably asking for additional information just on some of the caseload stuff, because this is just an important piece, I think, for so many families for something that is extraordinarily expensive in and of itself, and for which we rely heavily on federal funding in order to make possible. So thank you for the time, and thank you for answering my questions.
Assemblymember Brown May.
Thank you, Chair. I do have a couple of questions, if that's all right. Thank you. I would like to go back and talk through the new IT system that you just talked about, the RFP process that we're in process. It's my understanding, though, that we had a vendor. We anticipated we were going to launch this new system, and then the vendor was unable to complete the deliverables. So could you talk a little bit about some of the issues that the former vendor experienced in attempting to implement the new program? And then what are the steps that you all are taking to make sure that this doesn't happen again?
Thank you for the question. For the record, Lisa Swearingen. So the child care program came under my purview last year. And when that happened, I started digging into the program and trying to get an understanding on childcare. And when doing that, my background is a lot with IT projects, very large IT projects. And so I started asking a lot of questions. And then the system came into conversation, and when I dug into it, there just was not, they were not meeting those deliverables that we needed and what the information that I wanted to see out of a system to meet the need that we needed. So we needed an eligibility system that we could process applications in, enter timesheets in for these for the providers, issue payments from that system, do reporting, possibly have a payment portal or a provider portal where they could go in. So this system that we had was technically a case management system, and it was just not going to meet the need, and they were not meeting the deliverables that had been set for them. So I gave them a list of things to do. I did not receive those things, and I issued a 30-day to cancel the contract. With that being said, while that was happening, because there is some confusion, I do have a contract with Deloitte right now that they are working on our NCCS system, which is our old, ancient childcare system that wasn't working before, right? And so I had Deloitte come in. They've been making changes. They've got that system up and running. It's a little band-aided, but it is working. We're pulling better data. We're processing payments. We're determining, we're entering timesheets into there. The project I talked about, we have 20 providers that are signed up right now. 12 of them are actually working in the process where we're entering their timesheets and issuing those payments within 14 days, which is very exciting. And so the system itself, and that we have the 3 staff that we were asking for, that was for the child care system that was originally in place to when it got up and running. We will use those individuals as well for the new system when it's up and running. So I'm not anticipating needing them right away, but I would assume by October, when I would have an RFP and a contract in place, because I'm hoping the RFP went to purchasing last week. And so then when that happens, then I will be able to have the staff to help with implementing the training and all of that with getting that information out to those providers.
Thank you for your hard work on managing. I'm assuming, and I'm just going to put this out there, that our IT contracts are pay for performance, right? We're not front loading system payment for systems that never actually get deployed, as we have seen that a few times in our history. So congratulations on actively managing this IT project, right, for deliverables. That brings me to the next question, which is really about the 3 positions that you mentioned. If we anticipate the RFP process is not going to be completed and a contract won't be in place, do we need to start those 3 positions effective at the beginning of the fiscal year, or should they be delayed as you anticipate launching the new system?
For the record, Lisa Swearingen, I think we were hoping to have the positions by October, so around October 1, which is our norm. And that's mainly because I'm hoping to have a very short, expedited RFP process. And mainly because my concern is I need to get a system that can do what we need it to do. And NCCS is going to hit capacity very fast. And so entering all of these timesheets into that system, I don't want to turn around and be in a position where it's now taking me 30 days, 65 days, whatever it is, right, to get those payments back out again. And so I think it's just really important to understand that if I get them in October, and then they can be part of that requirements and that building and that understanding how that system is going to function and be an active partner in that build, is going to be key to making a successful project.
Thank you. And then one final question, Madam Chair, if I may. Yes. Do you anticipate then that this new product would be an off-the-shelf product, or are you anticipating a custom build for the entirety of the program that it will be required to manage these cases?
For the record, Lisa Swearingen, I believe we did not ask for an off-the-shelf. I think that we like to customize what it is that we're looking for due to the different options that are available. And so we were not looking, my RFP does not state that it's an off-the-shelf product. We are looking for something that would meet our need. If a vendor bids and they have an off-the-shelf product that meets the needs of the RFP, then that would be fine. But I didn't limit to just an off-the-shelf product.
Thank you. And similar question, will we be able to use any of the work already done on the previous vendor on the new one, or is it just scrapped?
For the record, Lisa Swearingen. So the current vendor that's working in NCCS, we should be able to do, and that's one of the things that's in the scope of work, is being able to do like a conversion so that we're not having to recreate the wheel on a lot of these individuals. And so there's always a data conversion piece that needs to happen so that we're not, and we can just upload those current families and save time, right? And it's not as error prone if you're already pulling in the information that's been verified.
Great, thank you. Senator Titus.
Thank you, Madam Chair. So I appreciate delays in finding appropriate vendors and all of those things, but that's talking about computers and information. What I want to ask a question about is regarding the actual wait lists and the people that are then impacted by this computer programs. And do you, like, for these services and these numbers, do you have a process are you, because this wait list really bothers me. And then once this computer is up and running, do they get reimbursed, like back pay, so to speak? Are they, how are we catching up with this? While we're waiting for this computer program, we have real lives being affected.
For the record, Lisa Swearingen. So the current wait list that we have in place right now has nothing to do with the system. It has to do with what we can sustain for our caseload, and that's what's currently on the wait list. We had originally stated, I want to say it was like 2,400 individuals were on the wait list, but that number has come down. We now have about 1,832 individuals on the wait list. So we are seeing those numbers come down as because we cover those populations, right, that are on TANF and foster care. So they at risk, we move those in, and they're not subject to the wait list.
That's good to know. You subcontract with other groups then that offer services. Is that how that process works? I mean, this wait list that you're taking down to 1,000. How were you able to do that?
For the record, Lisa Swearingen, I would have to get back to you on that one.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you. Members, any other questions? Thank you. We will go to budget account 4862.
Robert Thompson for the record. Budget account 4862 is our energy assistance program. Our energy assistance program provides assistance with heating and cooling costs, heating and or cooling cost for eligible Nevadans and is funded through the Low Income Home Energy Assistance Block Grant and funds for energy assistance and conservation. This caseload fluctuates in this program. The caseload does not fluctuate as much as the funding fluctuates. And each biennium when we come in, we request what we believe we are going to be receiving from the federal government. In this caseload, we are not told always ahead of time what the federal government is going to be issuing us. So we go into the biennium requesting what we know we're going to be receiving, and then we adjust it during IFC throughout the biennium. We have one enhancement request in this case budget account. In this budget account, we have our positions, and it's a very, very small budget account. There are approximately 20 case managers in this small caseload, but 7 of those case managers and 8 of our administrative assistants are intermittent positions. And because we have so many intermittent positions and a very small caseload, we're not able to fill them. We are finding that our employees will not take intermittent positions when there are full-time positions in other budget accounts, in the SNAP caseload, in the TANF caseload, or other areas of the state. So we are requesting to convert these positions from intermittent to permanent, and there is no general fund impact to this request. And that concludes the presentation for 4862.
Thank you. Members, any questions on this item? I did have a question. I know this is a budget subcommittee, not a policy committee, but I did have a question. I was surprised there's no wait list, and this would impact the budget, but can you just share, how do you advertise it to families thinking about people like in my district?
Kelly Cantrell for the record. So the outreach efforts on this are, we do social media blasts, but one of the big helpful things that we do is we speak to the utility vendors who then will share the information with their customers to help get the word out. We also have sites all around the state who take these energy assistance applications on our behalf. They are also made aware so that they can do outreach on our behalf too. And we are always working on other ways to get the word out on this program.
Okay, thank you. Members, last call. Great. Thank you so much for all your hard work and all the budget today. We will now close these budget hearings. And now I will open it up to public comments. So because of time considerations, persons offering public comment will be limited to no more than 2 minutes, and I will be taking time. Please state and spell your name for the record. And to provide public comment by telephone, you would dial 888-475-4499. When prompted, please provide the meeting ID and enter 892-3867-7475, and then press pound when prompted for a participant ID. We will first start in Carson City. Please state and spell your name for the record, and you may begin.
Good morning. My name is Sabrina Schnur, and I am here on behalf of Wonder School today. My last name is spelled S-C-H-N-U-R. We'd like to thank the Division of Welfare and Social Services for their work on child care assistance and TANF expansion. But even with those supports, Nevada is missing 100,000 slots for child care. This is because the Division of Welfare and Social Services is not and should not be tasked with increasing the capacity of child care providers. Nevada needs a central location overseeing childcare and ensuring Nevada families have accessible, affordable childcare in their neighborhood. I'm with Wonder School, and Wonder School's top priority recommendation is to create a new supply, which can be addressed with tech and strategy. Like many other states Wonder School works in, and according to many studies, we know that there are thousands of Nevadans who need access to childcare, but they make too much to qualify for subsidy. Recruiting more providers who are great at providing childcare, but need support in running the best childcare business they can, and helping them get through the difficult licensing process, will be an important part of giving more of the workforce access to childcare in Nevada. We would also love to see streamlined licensing and a more robust childcare finder for Nevada families. Thank you.
Thank you so much. Anyone else in Carson City? Anyone in Las Vegas? And with that, AVH will go to the phone lines.
Thank you, Chair. The public line is open and working, but we don't have any callers to provide public comment at this time.
Thank you. And again, I want to thank the Division of Welfare and Supported Services. We know you help Nevadans who need it the most. So thank you for all that you do. And with that, this meeting is adjourned. Thank you.